people need to know, empowering them to learn and grow. We discuss what people need to know, empowering them to learn and grow. Give praises to Jehovah, from whom all blessings, blessing and knowledge will flow. Blessing and knowledge will flow. The Village Talk Show, dedicating to empowering the community to live a healthy, safe, and financially capable life, helping each one of us in realizing our dream at any age, any point, starting from today, day. Success. Come all to learn and grow. Welcome to the Village Talk Show. Come all to learn and grow. Welcome to the Village Talk Show. We discuss what people need to know, empowering them to learn and grow. We discuss what people need to know, empowering them to learn and grow. Success is not spoken, it is done. Success is done. Come on now. The Village Talk Show. Talk Show. The Village Talk Show.
Hey, good afternoon, good evening, ladies and gentlemen, and thank you for joining us right here in the Village Radio Talk Show, where we're dedicated to empowering the community to live a healthy, safe, and financially capable life through education, helping each one of us in realizing our dreams at any age, at any point, starting from today. Where success is not just spoken, it is done. What are you doing to be successful? Andre,
You.
how you doing? How's your week going?
Thankful, grateful, as busy as the week has been. But life. Gotta be grateful for that.
Got you.
I'm great.
John, how you doing? How's your week going, Dr. Sampson?
I'm grateful. Despite the trials and tribulations in life, I'm grateful just to be here.
That is an awesome thing, So, Andre, what quick advice you have for our villagers out there who we love and want to preserve?
Smoke that weed.
I don't smoke, folks. I'm in the fun too, but yeah, none of that. Advice, man. So I remember when I was in my education program, and definitely had some struggles there. And I saw a quote that says that don't give up because someone is looking up at you, admiring you, and trying not to give up.
All right.
So,
John, what's the quick initial advice that you have for our villagers? The quick initial advice.
Faith over fear.
Okay.
Despite what you may be going through, always remember that your faith and your belief in yourself, and most of all in the Almighty, will always carry you through. It may not be when you want it, but it will definitely happen.
All right. Good advice for our villagers out there. And thank you all of our villagers for joining us. You make this show happen. We'd love to hear from you verbally today. All right. Our phone line is up. Andre, what's the phone number?
hold on. 347-746-6598. That's 347-746-6598.
Excellent. We have a lot going on the show today. The big thing that we have so many things to talk about. We have Dr. Eastlin. He's coming on tonight, later on, talk about leadership and equity, community health and purpose. He's going to be talking about innovation and impact, and the big thing about mentorship, youth and mentorship, especially as a person of color. Hopefully, we could get some of these topics right. Right. You have a filibustering by Senator Cory Booker out of Jersey. You had the Department of Justice to seek death penalty for Luigi Mangione. Mass layoffs continue at Health and Human Services. Oliver Stone testifying before Congress. Kathy Hochul and lawmaker missed budget deadline, and Adams corruption case dismissed. And Adams will run for re-election as an independent. Where do you want to start, John? You want to start politics? You love politics. Where do you want to start? I give you a choice to start today. John, is he frozen? Yeah, he is. So, Andrew, we'll start with you since John is frozen. You guys can hear.
What you said, where we're going to start? I get to choose?
Yeah, you get to choose. Where do you want to start?
I always like to start at the economics piece. So, I've been working on my book, so I've not been able to read up as much. But what I've been seeing, Trump really dropped his tariffs on all of the countries, so many of the countries, yesterday, and the market tanked. Now, people who might be playing the downside, good, congratulations, you probably made a whole lot. But it's a fear where people are having now, the panicking and everything. We kind of seem to be, not seem to be in stagflation right now. Labor market weak, manufacturing sector, there's weakness here. And so Trump doing these tariffs, even his supporters, some of them is just like, bro, what are you doing, man? It's like the more and more recession is feeling like it's about to come. Now, in terms of where wealth's being made, this is where people should be, considering, okay, what companies do I want to get? So we should look at fundamentals, look at good companies, look at great companies, do your research, and consider what those companies are about, know them before you invest in them. But it's a scary time, being mindful with the money.
I want to make sure that we add, that because Trump is talking about Buy American, which is not necessarily a bad thing. The problem that a lot of us are having is choice, right? In America, we're used to choice. And his behavior is eliminating choice. And by these high tariffs, it's not going to bode well for Americans and their dissatisfaction, right? 25% tariffs, all these different things. It's going to be highly problematic for the American value and the American system and the American economy, right? The American economy is going to have issues with these high tariffs. But, somebody reminded us, hey, know the stocks that the president is buying, his staff is buying for over the next 3 or 4 years. Those stocks are going to make it pretty far, right? Those stocks are going to make it pretty far. So, that's one way to look at it, right? So what do you think, John?
I think you're correct. I think if you, bottom line is it's definitely going to have an impact on the economic engine. As you see, Wall Street, I think it dipped to 1,400 points. Today we lost about 1,400 points. The question is whether we are in it for the long haul or short haul. Because if you look at your 401k now, you can be like, I'm astonished how much money you lost. But it's all about the duration. But I think with these high tariffs, what prevents those other countries from, reverse tariffs? You know what I'm saying? So to the president, unfortunately, he looks at it as a game. He says, okay, American people have to suffer, just short term, but that short term suffering can lead to long term damage. So that's something that he needs to consider.
Right, and it's to me, these efforts will be breaking America's backs, right? Because it's highly problematic, right? It's highly problematic for America. Right now, I went into the supermarket. Can't remember the day I went in. Probably last week I went to the supermarket to get my mom something, or my mom wanted. My mother had a special diet, and I went to get her whatever it was. I went to get her. I don't remember what it was, to be frank. And I think I had like 10 items in my cart, John, and those 10 items were over $150.
Wow.
Right. So the question becomes, can America sustain that rate, right? Can America sustain that rate? Especially since economically they're not going to make a lot of money. Or if John, it's funny. I don't believe in raises, right? I don't believe in. People are like, why do? Because if I make $100,000 a year, and it sounds great on paper, right? That I make $100,000 a year, I'm paying $3,500 a month.
Right.
Mortgage. Not mortgage, rent. Forget about mortgage. Rent. Right? I can't afford to buy gasoline to put in my car. Right? So you look good. Oh, I'm telling my friends I'm making over $100,000 a year. But in reality, you're in a debt-filled world. Debt-filled. Right?
As I said, debt is good. Debt is good.
Yeah,
you can't pay for it no more.
Right. Exactly. You know what I'm saying? So that's why it's not that I don't believe in raises in per se. What I'm saying when I say I don't believe in raises, I want the raise to truly reflect a growth in income, and a growth, not a growth in income, but a growth in your American dream, right? Which giving me money in the right hand and take it out in the left, especially at a greater rate,
right,
is absurd.
Mm-hmm.
Right? Is extremely absurd, and people really have to understand that is what's happening in America. Right? You give me 10, you give me what is it? You give me a 10% increase and increase eggs by 50%. How
right.
is where are you making money?
Right. Whenever I'm making
right, and so people have to understand that they're getting bamboozled, but because we're so used to loving money, right? Because we're so used to loving money,
mm-hmm.
don't understand the quantity versus quality.
Got it.
You know, so we have to be America, we have to be careful. Don't be so glad that you're making $200,000 a year, $150,000. Don't be so glad about it. Right? Good evening, Star Girl. Right? Don't be so glad about it when economically you're not much better off. Right? imagine now the city is willing to give $2,600 for a 1-bedroom apartment. Imagine that.
Right.
A 1-bedroom apartment at 26, and you have to be at a low income rate. So, you know, those people out there who are not paying your rent, pay the damn rent. Because if you have a good landlord, pay your rent. I'm just telling you, because you can't afford to live anywhere else.
Right.
You have a landlord that's giving you have below market rate, and you decide you want to screw them, and they take you to court and you're gone. Where are you going?
Right.
Right. So pay your rent. Do what you need to do, but pay your rent.
Pay your rent, Roderick. Pay your rent.
No, but I'm dead serious, John. I'm dead serious. Imagine a 1-bedroom apartment that's 750 square feet that you're paying $2,600 for. You know how big that is? That's literally, if you own a house, is literally your bedroom, your kitchen, a dining, eating area, living room. That's what that is.
Okay.
750 square feet ain't much.
Not much at all.
Right? So people who out there, yeah, thank you, Star Girl. Right? You don't like to pay rent. Some people like to play games like they rent in one house, they move there for 3 months, and then they don't pay any more rent because there are people like that.
Yeah, that's good. They are.
You're going to get screwed. Right? You're going to get screwed. So I inform people, pay your rent so that you have a good place above your head. You know, I always tell my children, and I will repeat it always. If you have a roof over your head, you always have some place to go home to. And if you're hungry, nobody will know because they don't know what's inside of your house unless you invite them in. Right? So take care of your roof above your head first. Anything else? John, I don't know if you heard all the topics we have on, so I'm going to give you the next choice. Again, chime in, call us. If you have any comments, call us at 347-746-6598. Again, that's 347-746-6598. Call in. You know, we love to hear from you guys. We love the text. But I was told that it's good when our listeners call in instead of just texting online. So if you're able to text to call in on any topic. If we're not hitting a topic that we might have missed something this week, just call in, let the villagers know. 347-746-6598. Call in and say whatever you need to say. We lost John. So our great Mayor Adams. Two things, Andre. Right? Two things happen. Thing number one, right? Thing number one, his case against him, one of the cases against him, was dropped by the DOJ with prejudice, right? Because the Judge Ho, stated that Donald Trump cannot later come back. President Donald Trump, my apologies, cannot come back and use it against him, right? Personally, I think if you don't have anything in him and you're going to drop the charges, just drop the charges. Don't hold on to nothing. So I'm glad the DOJ did that because it kind of paves the way for some people who are complaining about corruption.
Right.
That this now makes a difference in terms of what is happening with Eric Adams, right? And it shows
Back up a little bit, yeah.
it shows how the Democrats, what John and I constantly say, they take things too far. And this is an indicator, right? The judge didn't say with prejudice, right? But essentially is with prejudice. John, you want to explain what that means?
Yeah.
The judge said his case is dismissed with prejudice.
Explain to our audience what that means.
Prejudice means that you can't bring back the case. You can't revive it.
Mm.
All right.
Without prejudice means that you can revive the case at some point in time if there's additional information to gather, whatever it is. Yes. So
Okay.
basically, in the mayor's case, he dismissed it with prejudice. So that claim that he's going to be beholden to the Trump administration is no longer there. And it just, to me, it just shows you how subjective prosecutions are. It's not objective, my listeners. It's definitely not objective. If the U.S. attorney has an agenda and their intent is to indict you or whatever it is, they may just not like you. I don't think it's not that simple, but most of the time when there's a judgment called, it's never in favor of the prospective defendant. It's always in favor of the government. So this time you had an objective pair of eyes who came in, and you could see this going back and forth between DOJ in DC and the Southern District in Manhattan. And you can see how political the prosecutions have become.
I want to add, even if the judge is on the other side, right? Even if the judge is on the other side, because I think you bring a good point, John, about the objectivity or the subjectivity of an action, right? Donald Trump has made it very clear that his behavior is subjective and biased. He has made that extremely clear in America. So whether or not, and so people who don't believe in Donald Trump, right, they believe in his justice system, if that makes sense, right? They believe that he has the right, although they're not saying it, although they say he's a loser, although he's saying this, he's saying that, they believe in his actions because they're making it allowable, if that makes sense. Because at the end of the day, it's wrong that you got rid of Jack Smith because he charged you with something. Oh, you charged me? You got to go. Right?
Well, Roger, we all know the Democrats, they always, it's unfortunate. The Democrats always talk about due processes, just like how they're saying due process for the migrants that the president is sending to El Salvador and home. They're arguing they should have the due process here in the court. However, you don't hear them yelling, that for Mayor Adams. Let the process run its course.
Let's go back to that for a minute before we move forward. Do you know that they're sending people to Central and South America without due process, and then they have to fight due process in America, but they can't because they're not in America? So if the person who's legal leaves the country and loses their permission to be in this country, they cannot fight the negative charges against them. I just, you know, when you said that, John, I am reminded of that. So if the government claims that a migrant is a criminal, deports that migrant, the migrant has no system to make it back to the United States to fight an erroneous, on a biased deportation. And that is very sad.
Just about those 2 young girls that they deported by mistake.
Exactly.
Yeah.
That's a good example, right? That's a very good example right there. You deported those 2 young girls, and those 2 young girls have no possibility. And then by the way, ladies and gentlemen, while I'm at it, I'm just going to give you some free advice. But work on it on a case-by-case basis. When the government put a stamp of 10 years on your visa that says in 10 years you can apply, that is hogwash. Depending on the crime, don't even bother.
Right.
So when you decide that you're going to plead guilty to a charge, a guilty charge for a lesser sentence for an immigrant is a death sentence to be deported.
Correct. You're in the system now.
Okay? So plead not guilty if you can. I'm not saying in every case it might be different. In every case, it might be so bad that in some cases it might be so bad that you do say, hey, I'll take the charges and go home.
True.
Right? So you have to decide what it is that you want to do. What is better for you? I just want to make sure I tell you that. Don't take my advice if you're looking at a life sentence, right? That doesn't make sense.
Yeah.
You know, so just a thought, John. You know, what about the fact that he's running as an independent? What do you think of that?
You know what? I think, go ahead, Andre. Go ahead, Andre.
You're muted.
As an independent, I understand why. You face if I guess from Eric Adams' perspective, really, or stance, things he has tried to do, or how Democrats have come at him because of what he has tried to do, and he believes in his mind that he's doing the right by New York City. And I guess also he doesn't necessarily want to go towards Republican because of what's going on in that camp.
Right.
It's like, let me just run from the middle. But I don't know, we've seen the middle run in different elections and not win. So, I guess he's trying to like play a balancing act.
Right.
But I understand why he's running from that angle. I think a lot of political officials have run in the middle because they don't like how their party is, but they don't like the other party. So I understand.
I think, if his pathway to victory is, he has 2 months in which to do the Democratic primary. Short period of time for him to do it, to raise money and to campaign. It's very difficult. That's one. Second of all, him wanting to run as an independent gives him an option for the people. It's about the people, and come November, they'll make their choice. So I don't see this as bad. I see it as an opportunity because of what transpired with the case and everything else. So he had to make the move, and this is his move.
One of the things that no matter how much we talk about it is that people vote, right? People vote based upon along party lines,
right?
Democrat, Republicans, whatever the case is. So that is a trepidation of mine that there aren't enough independents. That's certain, right? But to get people to cross party lines, I feel like it's going to be a struggle, right? I feel like it's going to be a struggle for his candidacy as mayor. I'm sure the independent party welcomes the opportunity, right? But I don't know that the voters will go across party line, and I know that that's the hope, because there's still a lot of people who believe in him. But there's some people who literally just go to the ballot box and go Democrat, 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 Republican, 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 Republican. How does he reach those people who are still in his favor in his boot camp?
I mean, he would have to have the way how Democrats promote and the way how Republicans promote. He gotta have that camp. You know, like a lot of people are just taught to just either do Democrat or do Republican, whichever camp they're on. A lot of people aren't necessarily taught to be critical about, okay, if you're gonna vote Democrat or if you're gonna vote Republican, like who are these people you're voting for?
Well, Roger, well, you know, an example of this is what Mayor Byron Brown did in Buffalo, Andre.
Mm-hmm.
He lost the Democratic primary and he came back and he won, I believe, as an independent in November. So it can be done. You're right. Depends if, it can be done.
I agree, So how did he I mean, I guess his constituents, the people who support him, they were really following heavily and paying attention, and they realized where he's gonna be running, and they went that way too.
It's all about re-educating the voters.
Yeah.
But what's good is he's mayor already, and he has the popularity. Good, bad, or indifferent, he has that, and he can continue in that position.
That is true.
So there's only temporary stuff.
Let me see. He has a tough time.
I mean, it's going to be tough. It's not going to be easy, but there's a lot of people because of his name recognition, whether positive or negative. But it's about what you produce for the people and show them that. Show them what I have done. Show you my track record. If you eliminate all the noise, this is what I have done.
Yeah, that is true. That is definitely true. Senator Booker spoke for several hours last night, of course, in protest against Trump policies and action. Protests could be related to an ongoing issue or decision made by Trump. The type of protest is part of a broader trend of Democratic lawmakers opposing Trump's policies, and Booker's speech focused on unity, justice, pushing reforms reflecting the political ideals. Protests highlight ongoing tensions between Democrats and Republicans and key national issues. And one of the things that's just crazy to me too, which the two-party system, I get all of that, but it's just always just so mind-boggling that it don't feel like we can ever come to a middle ground, ever. It's a back and forth on a continuous basis, But I mean, I didn't necessarily get to listen to all of the Cory Booker stuff. But I guess what's y'all thought on that?
Well, I think, a lot of people were happy to see the aggressiveness that the Democrats were pushing back against Trump, because a lot of them were getting upset. The constituents are getting upset. They said, this man is doing so much and you're doing so little. So this was an example of, the Senate Democrats showing chutzpah to tackle this individual, not literally, but giving him notice that we the people will chart your course.
Right, that makes sense. Yeah.
John.
Yeah.
The Democrats have taught people of color well. And it is manifesting itself now.
Right.
Let us be reactive and
Right.
not proactive. Like, for
Correct.
example, they spent $25 million for a judge in Wisconsin, the Republicans, but yet still he lost for a Supreme
Right.
Court judge in Wisconsin.
Right.
Right. And that Supreme Court judge lost. Reactive. A lot of Donald Trump doesn't want to get the Republican from New York to become the national advisor, security advisor, because he's afraid of the loss. Reactive. Right.
Mhm.
Donald Trump, however, is being proactive, right? Because he foresees the possibility that the Republican might lose another seat. So in his proactivity, he decided, I'm not taking her, right? We Democrats need to be proactive. You can't stay out of an election. You can't do this, right? You can't just jump at you. And we are bandwagoners, right? We are bandwagoners. People don't like when you say, oh, we're jumping Eric Adams, we're jumping Andrew Cuomo, we're jumping.
No, we cancel them. We cancel them. We cancel them. We cancel them.
Right. And then, oh, a person is guilty until proven innocent. Right. So that's the bandwagon I'm going to go on. He is guilty. She is guilty until proven innocent. And that's a problem with the Democrats. And that's one of the reasons why we will have a very hard time succeeding at great levels. Right? We have Donald Trump, a 2-term president,
right?
Seeking to get a third, and he's acting on it. Right? He's acting on it behind the scenes to see if he could get a third term. What that's doing about it? I haven't heard peep or enough peeps from the Democrats, right? I don't even hear.
You know why? You know why you don't hear peeps? Because don't get distracted. Trump does those things to distract us from what he's doing.
I don't think so. I think he sincerely is looking for a third term.
Trump, no, he can't. He's not going to be able to run a term.
See, that's the problem. We keep saying, John, he can't, he won't be able to. We keep saying that. The fact of the matter is, until it is in writing, until he is denied by the Republican Party out loud,
right,
that take an oath to follow the Constitution of the United States of America,
right,
until that happens, we don't have an answer.
Okay.
That's my right, exactly, Celia. He keeps going. So until there's a commitment, there has to be a commitment that they're not going to try it. And by the way, if it's out there, it's real. That's another thing. It might be a distractor, but it is real. Right? What are we doing?
Right.
Who is the Democratic Party leader right now, nationally speaking?
I forgot the gentleman's name.
Right? Hakeem Jeffries. Right? Hakeem Jeffries right now is to me, Hakeem Jeffries, the two leaders to me need to go. That's just my opinion. That they both need to go. Right? Because they're not making enough of an argument to get him out of office. Right? But that's just me, right? That's just one person speaking. I'm not saying that he has to go, because again, let's be clear. 77 million people voted him in office. So it's going to be hard to change that. It's going to be hard. Because I guarantee you, if he runs again, because he changed around just like Bloomberg did. He was that popular. If he's able to change the Constitution and get it, He run again. You know what? You know what, me, John. John.
I really feel like he won't be able to. But again, not saying it's impossible.
I think so. I do agree, but I think that until we see something that says that he cannot, that he will not, then I believe that until that happens.
Yeah, with all the reading I've been doing and the research I've been doing, I just can't see it happen. I'm not saying it's impossible. I just can't see it happening. I don't think the powers to be gonna even allow that.
Look at what Celia said, and he has a base that supports whatever he does.
Well,
that's the relevant fact.
Yeah, but if he goes too much, and because remember, a lot of people even voted Trump and thinking like,
those people are stupid.
But no, the thing ain't gonna be good for the economy. But look at this now.
Again, but those people are stupid, John. I mean, Andre, you know why they're stupid?
Mm-hmm.
Because they made the same argument in 2016.
Yeah, but look, what I'm saying is that even though he has a base that supports him, if he goes too crazy off a deep end where they're like, whoa, what are you doing? Like a lot of them didn't think he was gonna do this with the tariff. And there it is. So it's not that they'll always support him. If he goes too crazy, I'm like, all right, bro, we don't want you back here.
But but the point that I'm making is that happened in 2016. That happened in 2016. That's why he lost.
Mm-hmm.
But they immediately voted him back in overwhelmingly because the Democrats said, hey, I'm staying out.
Yeah, he tricked them. He tricked them this
he
time
trick
again.
Nobody. Who you telling? John and I say it all the time. He is doing what he said he was going to do.
Yeah.
That's what he's doing.
Yeah.
So, you know, what Celia writes is 100% correct. His base is going to support him. And you know what? If they want him back in, John, you know what I was saying? I'm sorry. And I paused for a minute. When we talked about giving term limits to Congress and term limit to Congress overall, the House of Representatives and the Senate. Senate 3 terms, Congress 6 terms, right? Or 8 terms, whatever. But put a term limit on Congress, just like you do for local offices, right? Which makes it impossible for them to have that election.
By the way, our guest is here.
Yeah, no, I see him. Paulette writes that they voted him in because he was a woman who is black, and that he was running against. I don't know if we agree with that.
Yeah, I wouldn't necessarily agree with that.
That's part of it, but I don't think that's
yeah.
We did not come out and vote the way we were supposed to.
And but at the end of the day, he got 3 million more votes than he did last
Exactly.
year. Health and strength, right?
You want commercial first and then?
No, not yet.
Okay.
Before we bring him on, we get commercial. Our guest tonight, Dr. Torian Easterling, talking about health and strength. Think about your health, right? So please listen in, mentorship, leadership, young black man doing his thing. And, you know, so we're going to shift from politics, from what's happening in New York City. We're going to go a little bit into your health and strength. This is The Village, where we talk about the whole people and not just part of you. And we are sponsored by Andre. Let's talk about some of our sponsors.
Let's go.
Want to get your personal income tax, business corporate tax, self-employment tax, quarterly tax, payroll tax, or sales tax filing done professionally?
Yeah.
Call U.S. Barrett LLC, 718-676-0519, and take the worry out of your personal and business life. Tax compliance issues should be left to the pros. So when you want your business to grow, call the pros, because a successful business matters. U.S. Barrett LLC also handles accounting, bookkeeping, business startups, consultation, real estate, and many more services. Call U.S. Barrett LLC, 718-676-0519, and ask for Howard DaCosta, CEO, to book a 1-hour evaluation at no cost to you. Take remote control of all your needs, and U.S. Barrett LLC will follow your lead. Want to work but don't have a social security number?
Yes!
Find out about getting a tax ID to pay your taxes. Call US Bear LLC or log on to www.usbear.com. Team up for success.
Call Howard Housing Solution today for all your real estate needs. Sellers, we can get top dollar for your home, and our vast network of professionals can facilitate your move and help you purchase your dream home in another state. Buyers, we have a pulse on the market and can get you in a home quickly. Property owners, we can manage your property efficiently and allow you peace of mind. So why wait? Call Howard Housing Solutions today at 646-825-5560 for your sale, purchase, or property management needs. Conveniently located in East New York, Brooklyn. You can come to us at 577 New Lots Avenue, Brooklyn, New York, or we can visit in the comfort of your home. Call Howard's Housing Solutions today at 646-825-5560. Howard Housing Solutions. Real estate simplified.
Footprints Cafes now offers Caribbean flatbreads, available in 11 mouth-watering flavors, including favorites like jerk chicken, curry chicken, honey garlic chicken or shrimp, ackee and saltfish, garlic cheese, and more. Our flatbreads are satisfying and can be enjoyed by the entire family. So make it a flatbread night at Footprints and enjoy the fusion of flavors. These flatbreads are so good, you might just have to fight for that last piece. Good thing there's plenty more where that came from. Get yours today from any of our Footprints locations. Want to enjoy your flatbread at home? Then order on Uber Eats and get it delivered right to your door. We'll see you there.
All right, Andre, I see Dr. Easterling on, but he's not on camera.
Thumbs up when you're ready, Dr. Easterling. Thumbs up. You ready? He's ready.
All right. Dr. Easterling, how are you, sir?
Good. And yourself? How you doing?
I'm not doing bad. Not doing too bad, as we normally say. Welcome to the Village, a radio talk show. I just have to say, first of all, somebody named Dr. Paulette Forbes. You ever heard of her?
Dr. Who?
Paulette Forbes. You don't know her as Paulette Forbes, as Dr. Paulette Forbes. You know, as Paulette Forbes, radiology over there, Brookdale. Her first message to you was, please say hello to my dear friend, Dr. Easterling. So I'm just making sure before Dr. Joanne Bryant asks you anything or say anything to you. And last time I didn't do that, she almost kicked my patootie. So she's listening in. I told her to call in and say hello, but I don't know if she will. So she said, please, and again, I repeat, so please say hello to my dear friend, Dr. Easterling.
Awesome. Yes. Ms. Forbes and I go back some time. We did some amazing work together in East and Central Brooklyn. So it's good to hear that she expressed her greetings.
Yes, I just thought I'd share that. Dr. Bryant, go ahead, lead us away.
Good evening, everyone. It is great to have everyone on tonight. Good evening, Dr. Easterling. Great having you on. And I would love for you to, we're not going to read your bio. We're going to let you share it with our audience. Who are you? And just sharing a little of yourself with our audience.
Well, awesome. Well, thank you so much for having me. This is, I know it took some time in the making, but to your audience, I'm Torian Easterling. I'm a family physician, public health physician. I've been in New York City for a decade, working on community health and public health. I currently serve as the Senior Vice President for Population and Community Health. One Brooklyn Health has 3 campuses. Many people know it as Interfaith Medical Center, Brookdale Hospital Medical Center, as well as Kingsbrook Jewish Medical Center. This is a system that was just recently created within the past 5 years, really to support healthcare services, but also to ensure that we are meeting the social needs of the community, because it is really important in order for us to be our healthiest and to achieve overall well-being. We have to address the social factors as well as the health issues that we have. Prior to this role, I was at the New York City Health Department for nearly 8 years, leading a lot of the same work, community health, research, data, to ensure that New Yorkers reach their healthier. So I spent a lot of time, helping to lead efforts during the COVID-19 pandemic. So folks may be familiar with my voice, given some of the work that we did, really to get the message out. And we were successful in a lot of different ways, really making sure that folks got tested and also vaccinated. But it was the work in communities of color and low-income communities, but the work overall that we were able to save lives. Hundreds of thousands of lives were saved, given the work that we were able to do. And so here we are now in 2025 with another challenge in front of us. And so I thank you for the opportunity to join you all this evening to talk about some of that work.
Thank you for joining us. And you just mentioned COVID-19, which is still around as of, I think a lot of people think, oh, okay, it's, that happened 5 years ago, that happened in 2000, whatever. But unfortunately, it is still around. And if people are not taking precaution, you will get sick. So thank you for bringing that up.
I want to ask you a question, Dr. Eastland. I used to see this Torian Eastland on television for the New York City Department of Health. Is that you?
That was me. Yes.
It didn't click.
My goodness. You really didn't know that?
It did not click. I swear to goodness, it literally just clicked. You're the same one I saw on TV all the time.
Do you get that often? Do you get that comment often?
Yeah.
Like Roderick.
No, but honestly, it didn't register because he and I serve on helping to save down, right? Helping to save down. But I never see him in person. We're always exchanging emails, or if I go to the SUNY Downstate at one of the events to speak, yeah, right. We'll know of each other, but it's always in passing.
Mm-hmm.
So this is the first time I'm actually having a direct conversation with you, and no, you're right. It didn't register. I apologize.
You got
it still happens. Folks will, they'll, I think the common occurrence is someone they'll sort of express their familiarity and they'll say, "Oh, you look familiar," like I'm a family member. And it's true because I spent so much time in your living rooms or wherever you have your TV. And so this, you look so familiar. And so then I'll remind them that, I don't know if we met before, we crossed paths, but I did have this other role once in a lifetime. And so.
Yeah, it was indeed a special role,
Yeah.
Especially when you're talking about COVID and keeping yourself safe, to children, and all of that good stuff. So I'm glad that we have had the opportunity to interact with you at this level. So tell me something. I
have a question before anything. One Health, for example. One Brooklyn Health. I know that there's been a lot of push. I've seen so many hospitals shut down. St. Mary's, this one over here and that one over there. Interfaith have been around for a very long time. Kingsbrook, if you're elderly, you know that you're going to have someone to go and visit. My grandmother was there. And I think you said Brookdale. So is the merging of the three, is that a way to, first of all, the different locations, Brownsville, then you have, I guess you would call it Crown Heights, in between Crown Heights,
Bed-Stuy.
and Bed-Stuy. So is that why they merged the three together, or is it just a way to keep all of the hospitals running?
Yeah, there's a little bit of all of that at play. Okay. I think, sort of just to go back a little bit, I certainly wasn't here for it. Even with the merger of, Interfaith, St. John's Episcopal Hospital, sort of the history of how you even have an interfaith medical center. Over time, what we have seen because of healthcare policy, because of the way that our government health insurance are set up. You think about Medicaid. Medicaid is health insurance for those who are low income. Medicare is health insurance that is set up for individuals that are 65 and older, or if you have a debilitating disease. And what we see with our Medicaid insurance is that, it doesn't necessarily cover the cost, doesn't really cover all of the services that someone is rendered. And so there's a mismatch, there's an inequity when we even look at our Medicaid coverage. Although people are receiving services, the cost of those services are not being fully covered. And so if you have hospitals that primarily rely on individuals who are covered by Medicaid, which are many of what we call our safety net hospitals across the city, like a One Brooklyn Health, or you even think about a St. Barnabas Barnabas Hospital in the Bronx, or Jamaica Hospital in Queens, where more than 50% of their patients are covered by Medicaid and Medicare, then they're not going to be able to make ends meet. They're not going to be able to generate the revenue that will cover their expenses. And so what we see with our safety net hospitals is that they have age-old facilities. They are understaffed. There are challenges within those systems. And yes, what ends up happening is that, they end up becoming financially restrained. And then we see this with a hospital like Universal Hospital at Downstate or at SUNY Downstate. And so these are the issues. This is the landscape of our healthcare system. And certainly, this is not unique to New York State, not unique to New York City or New York State. You see this happening all across the state and all across the country. And so, yes, there are measures and ways in which you can keep hospitals whole by either reducing their services, by downsizing the number of facilities. And you have seen this certainly with One Brooklyn Health, but you've seen it with other systems as well. Or you will see some of the larger systems begin to merge or to consolidate some of those safety net hospitals as well, right? And I think those are the approaches. But I think, sort of the larger issue at play, and certainly for Brooklyn, these are the questions. When what we saw during COVID, what we know so far is that hospital beds were really important during the pandemic, right? So to think about SUNY Downstate, a University Hospital at Downstate had to convert to a COVID hospital. We needed all of those beds to support individuals who had COVID-19 or were suffering from SARS-CoV-2. And so those beds were really important. When we look at the data, Brooklyn has some of the lowest number of beds per population. And so we cannot lose those services, those critical services, particularly for the type of health outcomes that we see in our community. So this is why the advocacy becomes so important, not only about keeping the doors open, but how do we ensure that we have the type of quality of care that we need in our communities. And let me just also say, and I know I've been going on a bit, that in this moment right now, given the federal climate, this becomes even more challenging.
Yes.
Right? To ensure that the hospitals that are providing critical services for our community remain open. And if the Republican Party has their will, then it's going to be even more challenging. So we have to figure out how do we make these complicated conversations really, really tangible for folks on the ground, because this is going to impact our people.
So you touched on a lot of points, right? A lot of points for us to dissect and address. One of the things that people talk about is doctors are in it to make money, right? You are now stating the opposite, right? And the most important point, and I want to harp on that point a little bit. The effect of poorly utilizing a hospital for the purposes that the hospital was made for. When you look at where One Brooklyn Health is, right? And where I did that already. and where these hospitals are located, especially in low-income neighborhood, Brookdale, you have Interfaith, you have Downstate, and a little bit touch of Kingsbrook. The question becomes, when these hospitals are affected, how does it affect the overall health of the communities in which you serve? And one of the arguments I make is Downstate, which service about 1.8 million people per year, Brookdale, right? And this is a trend across America.
Mhm.
What do you have to say to people who want good health care or the hospital that wants to provide it?
Well, I mean, the first thing that I would say is that they should, right? They should want the best quality of care that is available. I mean, that is the work that, that I certainly has been driving me about how do we ensure that every single person has the opportunity to equitable health care, right? Or just optimal health, right? We all want it. And what does that look like for my community, for my family, to ensure that others can also receive the same? It should not be reliant on one, me having a job, and then ultimately me having that job then gives me access to health insurance. We should want that for every single person, right? And so, short of making health insurance available for every single person, right, a single payer health insurance plan, which we have not achieved in this country, what we have in this system is a two-tiered system, meaning that you have individuals and commercial payers, whether those are some of the big names that you are familiar with, that it gives people access to some of the best hospitals and some of the best care. Then you have those who are low income that are unable to afford, even if they have a job, unable to afford health insurance. So they will sign up through Medicaid. Now, through the Affordable Care Act or Obamacare, we have been able to expand eligibility. I think people need to understand that if this administration has its way, they are aiming to roll back eligibility for Medicaid, i.e., health insurance for individuals who are unable to pay or unable to make ends meet and will make those decisions. So this is going to further perpetuate some of the disparities and inequities that we see in our data, right? Now, Roger, you also mentioned, if the hospitals are impacted, what happens? Well, let me just sort of take you through, right? So we're in Brooklyn, and your audience knows this. Over 2 million people live in this one borough, one of the most densely populated land masses in this city and this country. Over 2 million people live in this area. And as we talked about earlier, we do not even have enough acute care beds. But what we do know also in this same borough is that we have some of the highest maternal morbidity rates in this city, meaning that we have high rates of women who are experiencing severe health outcomes during pregnancy or immediately postpartum after pregnancy. We see some of the highest rates of gun violence incidents in East and Central Brooklyn, meaning that they're going to require tertiary care, surgical care, intensive care to make sure that that person is not only patched up, but that they can recover. We also have high rates of heart disease, diabetes, stroke. There are high rates of individuals who who are on end-stage renal disease and will need dialysis. Given all of the things that we know in our data, people are requiring high-level intensive care. These aren't things that you can necessarily do at your home. You will need a tertiary care center, i.e. an acute care center hospital, to be able to provide those care. So once upon a time, Universal Hospital of Downstate had a transplant team that was actually providing access to new kidneys for individuals. Those services no longer exist. We had more emergency rooms available. So as you close hospitals, you close emergency departments, Then you will have other emergency departments that will then become more overwhelmed. And then that wait becomes longer.
That's true.
Right? And then that wait becomes longer and you are delayed in receiving the type of services that you will need. And so when we talk about hospital closures, when we talk about what this federal climate means, it's not just going to impact individuals with Medicaid. It's not just going to impact individuals with Medicare. It's going to impact all of us. It's going to cause a stress on our healthcare system that we have not seen since we have seen during COVID, right? And folks will remember what COVID-19 was like if you had to end up going to the hospital, the delay, because our emergency rooms were packed. There were strategies that we were trying to move people around. There were strategies in order to make sure that people who needed intensive care services could receive them. These are the type of challenges that we are potentially facing in the event that this federal climate has its way.
Now, I have a question. I know that I think it was this week we were hearing about the I don't know. I don't want to pronounce it wrong, but under Kennedy, he's shutting down the HHA. If I pronounce it wrong, forgive me. How does that? Thank you. How does that impact our hospitals as well?
Yeah, so folks have to, want to understand that there is a federal agency, the Health and Human Services. The Health and Human Services, they are responsible for a number of different services, healthcare being one of them, the Medicaid budget being one of the largest budget line items in the budget, right? And so when they were talking about $880 billion, you cannot achieve that level of budget cut without going after Medicaid. And as we talked about, Medicaid really supports a safety net for individuals to ensure they get access to healthcare services. And so some of the first actions that the current HHS director has done is not only have we seen the support of this appropriation that is going to lead towards budget cuts and try to support billionaires, what it's also leading to is they have released thousands of people from their posts. And what are some of the roles, some of the important roles that these folks have been doing? Let me just name a few. Infectious disease surveillance. So the people have been watching how high flu has gone, bird flu that's going up, measles outbreaks that is happening. Even in New York City, in New Jersey, we've already seen one death this year from measles happen. People that have been paying attention to these to the surveillance are no longer at their post. They no longer have their job, right? You also have roles where people were doing injury prevention. So we have elders in our community. We want to prevent falls. We want to prevent falls from happening. We want to prevent elder abuse. We want to prevent gun violence prevention. People have been fired from those roles. So this is what is happening in our public health infrastructure, is that the roles that have been so critical in keeping people safe and healthy are really being decimated. And I think, go ahead.
Go ahead. Finish up your sentence. Go ahead. I had a question.
Just wanted to emphasize that, what this means at the ground level is that it makes it more difficult for people to access the type of services, food insecurity, a lot of work that, that we have talked about this before, really making sure that folks have access to healthy food to address their health outcome. These are some of the tangible ways that we're going to start to see people impacted.
Some like the farm, right? Some of the farms.
Absolutely. The farms, the growers who are in our community in East New York, in Brownsville, on Livonia Avenue, on Rockaway, where they are making sure that folks have access to fruits and vegetables. Absolutely, because those funds that they were relying on are already being impacted at the federal level.
So I want to talk about two specific diseases that affect our community greatly, and some of these impacts that will happen based upon this. In our Caribbean and Black community that One Blueprint Health primarily serves, right? It's not that it doesn't serve other parts of the community, but the higher percentage, you're going to use the hospital that's closest to you. that means that that's a general thing. Like most people don't really travel, you kind of use the hospital that's accessible. So you have a lot of Black and brown individuals who are using the network system of One Brooklyn Health, and in which we mentioned. Again, ladies and gentlemen, thank you so much for joining the village. We're talking to Dr. Torian Easterling, who is a family physician and an advocate for stronger healthcare within the system, One Brooklyn Health and New York City system. There's a disease that plagues us, two to be specific. One, diabetes, right? That's very huge. Two, heart or heart-related type issues, diseases, blood pressure, high blood pressure, low blood pressure, poor cardiac, issues, pulmonary, asthma, those types of respiratory or heart-generated issues. One, if you want to talk about some ways to help individuals with that, and two, to talk about the impact that some of these cuts at the national level, the local level, and the elimination of some of these hospitals, what kind of effect will they have in our community, in our system? I know it's a loaded question, but do your best.
Yeah, it's a loaded, and I think we're going to have to continue to have conversations. I mean, this is the work, right? And I think, beyond this conversation, the next step for us is to sort of think about how are we empowering individuals, leaders within our community, to hold spaces for more conversations like this, because not trying to be an alarmist, but as oftentimes we say in public health, as leaders and advocates, that that's part of the role that we have, is really to raise the temperature and make sure that people understand what is coming. And that tide, though it has not necessarily reached us, there are things that we can do to prevent. But the points that you raised are certainly are issues that we've been talking about for decades. We have seen a rise of what we call non-communicable diseases or chronic diseases in communities, right? You name them already: heart disease, number one leading cause of death. Across this country, we see higher rates of heart disease, specifically in Black and brown communities.
Right.
And that also extends into, kidney failure, diabetes, all of these chronic diseases. These are preventable. These are also diet-related preventable diseases that we're talking about. Now, before you even talk about heart disease, you think about the way that the body works. You're talking about the major organ, your heart, and then all the pipes that lead to ensuring that your heart functions, right? Your veins, the plumbing system that brings blood to and from the heart. All of that needs to be working at the top level to ensure that folks are doing what they need to do. Now, one of the leading causes of why people are experiencing heart disease, the number one silent killer, high blood pressure. Now, more and more people are beginning to understand why they have high blood pressure. More and more people are understanding that they do have high blood pressure. That means that they can do something about it. But sometimes it is a silent killer. It is something that will sneak up on you. So in order, you talk about strategies, it's really knowing your numbers. It's knowing what are the things that are going on with you, also knowing your family history, and also thinking about what are those modifiable behavioral risks: eating well, exercising, all the things that you can do, reducing your stress, and really changing your environment. But I do want to also level set us, and just the reality is, even when you can control all those things, you're eating well, you're exercising, you are reducing your stress, you're sleeping well, you're taking your medication if you do have high blood pressure. I think it's also important to understand that even in this country, because of what we have dealt with in generational trauma and weathering, structural racism still is a key factor as to why we see inequitable rates of hypertension and heart disease in the Black community. And if we don't say it, then we are going to be missing a key factor as to why we're seeing higher rates within Black community, right? And I think it's really important for us to name it, because it's also going to be important for us to wrestle with how this country has not dealt with the original sin, and then we can ultimately address it. And I think that that's really important work that we must do collectively, community, but also at a much higher level as well, when you think about the federal level.
I love that. I love what you're saying. There's so much to what you mentioned. That's just the surface, like you mentioned. We need a daily conversation about that, because our hospitals, local hospitals, our health is so important. Health is wealth, period. I know we have one of our listeners who have a question for you on the screen. I'm not sure if you can see it, but it says, how can we get more private physicians to use our community hospitals? Example, Emblem Health Physician have location in our community, but service hospitals outside of their daily location.
Yeah, it's a really important conversation. I think it also really requires more conversations between those health systems and the payers, because not all hospitals accept or really work with those payers directly. One of the largest payers that we work with at One Brooklyn Health is Health First. Now we are also working with a number of other payers, but there's certain arrangements that health systems have. But I think that really that also speaks to, and maybe this is what your listener is getting at, because it also dictates the type of access, right, that individuals have, where their physicians are providing service, and then it also dictate some of the really making it easier for you to access the hospitals that are in your neighborhood. I think those are some of the complex issues that, again, that healthcare leadership and at the state level they need to address. But I will say that those are the type of conversations that need to be lifted up, so people have a better understanding, not only of the physicians, but also price transparency, right? And there has been more work to really lift up that we need to standardize pricing at all of the hospitals, and that unfortunately is not a reality that we have right now in this city.
Right. So my question is, what drive your personal mission to improve community health, and how has that sense of purpose evolved through your work during COVID pandemic and beyond? So what is that fire?
Yeah, I mean, this is an important question, because I think part of what I do, and reason why I do what I do, is because I think people have said this before, but it's so important. You got to know who you are and whose you are, and I know the answer to both of them. I grew up in Essex County, New Jersey, Newark and East Orange. All of my schooling, except for college, I even went to medical school in Newark, New Jersey. And so it was intentional in that way, because I wanted to be back home. I wanted to, whatever skills that I was able to develop as I went through my medical education, I would be able to then bring that back into my community. I mean, I was on the street that my medical school is located. If I go south of that street, I would go to my elementary school. If I go north, I would be at my high school, all in the same street. And so I grew up. I spent majority of my young, impressionable life on that street in a lot of different ways, and I learned a lot. Right, common sense, but also book smarts. And one of the things that I began to fully understand when I went through my medical education is truly the obligation and responsibility that I have to ensure that I was giving back into my community. And I'll tell a quick story, because I do think it's so important, as far as my own development. Like so many other major cities where Black folks were at, Chicago, Detroit, Newark was also another one that also burst into riots because of the anger in 1968. After the Newark riots came what was called the Newark Agreement. It was one of the first of its kind, a social contract that the city made with the residents. And in that agreement, in that contract, that social contract, there were certain stipulations, certain commitments that the city said that they would do. They were going to expand their medical schools in the hospitals. They were going to raise the excellence of care in those hospitals. They were going to ensure that they also invested resources in doing community health. And they were going to also educate those residents in Newark into health careers. That commitment was made in 1968. And so I'm a direct beneficiary of that commitment because I grew up in Newark. I went to school in Newark, and I also graduated from medical school in Newark, New Jersey. And so understanding that agreement, understanding that stipulation, then it becomes important for me to also turn back and also ensure that both the work that I do is also addressing, some of the social inequities that we see, but also contributing to someone else, right, coming forward. And so when you fast forward in the work that I was doing in community health in New York City, it's not lost on me the impact that I was able to make and I was able to contribute to with my colleagues at the health department to ensure that Black and brown communities, that they were resourced with tests and vaccines during one of the most challenging periods in our life.
Now, you mentioned giving back to your community, being a part. You mentioned school, your elementary, and also your high school. So please share with us about your mentorship, because that, I'm hearing, hey, I didn't leave that. I'm still close. I'm in the hospital. I'm still close. I still want to go and give back. So I know that you co-founded the Young Doctors Project, an intergenerational mentoring program for young men of color. So elaborate on that, please. And don't stop me, Roderick. I'm glad he's muted.
Mentorship is important. I certainly wouldn't be standing before you if it wasn't someone pouring into me. Mm-hmm. There are so many mentors that I can name, folks that made sure that I progressed and I developed. Folks like Lonnie Wright, who was the Dean of Multicultural Affairs at my medical school, Dr. Gary Butts, Dean of Multicultural Affairs at Mount Sinai. Men and women who made sure that I was moving forward in my destination, and I think part of it is understanding again what is our role, toward showing that somebody else can also take our spot and being intentional in that way. And so when we started to understand, you look at the data, that we're seeing Black men are. The numbers of Black men enrolling in colleges. We even saw that the number of Black men enrolling in historically Black colleges is decreasing. We have seen data that the number of Black men enrolling in medical schools has decreased. We had less Black men in 2012 in medical schools compared to 1972. Right? Those are some of the startling statistics that we're seeing. And so part of what we also had to understand was that it wasn't just about the folks that were right behind you. It was also going earlier, right? Earlier in the pipeline and engaging our young boys to say, you can do this, right? There is a destination 10 years, 15 years down the road that is waiting for you. We just need to help you get there, right? And so I created this Young Doctors Project along with some great friends of mine, really thinking about how do we ensure that we're wrapping our arms around young boys of color, giving them the right skills in the knowledge to move forward. And so the Young Doctors Project actually started in Washington, D.C. We've been around for 15 years. We've been engaging young boys and really bringing them into hospitals, shadowing physicians. They're also learning how to do blood pressure and take diabetes tests, and they're bringing those skills into their community. So they participate in health fairs. It's been an amazing experience, and now we're bringing that same program into New York City, which I'm really proud of and really excited about. This will be our first class that we're launching in Brooklyn, and we're partnering with some amazing institutions in Brooklyn as well. So those are the steps that we're going to be taking. Yes, part of it is we got to address our health outcomes. We need to bring more resources and funding. but there's also a workforce issue as well. And so it's really making sure that young folks can see a possibility, right? And part of that possibility is having visibility.
Yes, yes, they need to see more Black men in schools, in the community, being role models, and just pulling them along the way to say, hey, I'm here for you. Like you said, putting an arm around them to say, hey, you know what? Learn a little of this and then come back and pour into your community. That is so important. John, you wanted to say something?
I had a question for him before, because I wanted to stay on the subject of mentoring for a moment. There are a couple of middle schools and elementary schools in your area that, and you talk about the Young Doctors Project, and one of the issues that I find, even for me, when I went into my college, right, and thought about being a doctor, the coursework was significantly different than my expectation. When you look at the Young Mentors Project, I speak very strongly of the school right down the street at PS 235 with Principal Nicola Grant, and I think she's listening in on the show, as well as my alma mater, Meyer 11, John's alma mater as well. And a lot of the students who are interested in the sciences at that young age. Does your program provide an opportunity for these young people to get not just see the doctor, getting what it's like at a career day to be a doctor, but do they have the access at that young age so that they understand the sciences, the complication, the hard work, the dedication, and the time that it takes? So one of the things I tell people, like, you can't be a doctor because you babysat your best friend's child, and you think that makes you a doctor, right? Or that might start your passion, but it doesn't really start to become a doctor. How young do you start, and do you go to make it a program, not just a career day? When you look at schools, like I just mentioned, there are a couple of schools around you, but those two schools I have an affinity to. So I just want to, and PS 235 is literally, you get out the corner on Lennox Road, you walk down the street, and the school's right there. So
you see how he's plugging that in?
I caught that. That was smooth.
Well, by the way, just for the record, just a little bit more smoothness. The principal said, "Oh, he's cute." You know, that's she's listening.
I'm leaving that alone.
That cute in a good way, not like verbiage usage, well kept together. That kind of cute.
Appreciate it.
Look.
See, look, she's right there. She just there she goes.
I appreciate it. Well, our mentoring program starts at high school, and purposeful because we're using the whole 4 years to stay engaged in that student's life. And so we recruit them at 9th grade, as late as maybe 10th grade, but really 9th grade, we engage them, and then we're with them for their entire high school career. And the opportunity for us is that, in this mentoring program, we call it intergenerational because it isn't just about the student, right? We engage graduate and medical students, and we also have folks at my level, right, who are attendings, who are already further in their career, because intergenerational, because the mentoring is from me to a medical student and graduate student, the medical student, graduate student to the high school student. And so, that continuum, they can then see what it would take for them to get to the next level. They don't have to see someone that is 20 years older than them. They can see someone who literally just got out of college and now in medical school, and they can sort of make that connection, more tangible and more concrete for their mind as they're developing. One of the things that we say is that we're not forcing anyone to be a doctor or a nurse or, to get their graduate degree. What we want them to understand is what is possible. And if they choose to go to law school or engineering school or to do something else, that is fine. But the commitment is that you are pushing yourself beyond your wildest dream, right? And that's what we want to do. That's what we want to encourage them. We're giving them life skills. We're giving them ways they can see themselves as leaders, even within their own community. and that obligation, right? That obligation that, yes, there's a lot that you're going to gain, but it's also about bringing it back into your neighborhoods, into your family, and educating people about the health things and the skills that you're gaining through this program.
Oh, wow. John, I'm sorry, John, did you have a question? Because I have another one if you don't.
No, I mean, it's just informative. But the state of healthcare and the direction in which it's going now, it's extremely questionable with the present administration. So, my thing is, one of the biggest things I think is the pay scale for the reimbursement rates for a lot of these hospitals, and how the state and the federal government needs to increase their reimbursement rates so some of these hospitals can survive.
I cannot agree with you more. Absolutely, yeah.
So I do have a question before Roderick asks his next question. You mentioned a lot of important points. How can and what should people do to be more involved with what's happening, and how can they support a movement of making sure or ensuring that healthcare care is not shut down for them and their community? What are some things that people should do?
Yeah, I mean, I think this is a really, really good question, because I think that type of that action, call to action, and that mobilization is, as you said before, so needed. I think folks are already connected to something, right? And if you're not connected to something, get connected. Get connected to a social organization, to your church, to fraternity, sorority, whatever you're already connected to. Start the conversation in that space, right? And start to understand what are some of the issues that folks are already experiencing. Again, it doesn't have to be limited to just healthcare, education, law enforcement, all the things that we know as we're starting to see that this federal administration is rolling back. They're impacting law firms, right? They're impacting our education system. They're impacting our healthcare system. There are things that we are already hearing and we know about that we can have conversations about. And then it's going to be important to then start figuring out how we're connecting to existing strategies. I think what we saw 5 years ago, following the murder of George Floyd, is that folks got out in the street, they mobilized, and they protest. I think we're going to have to do some of that. But what we have learned 5 years later is that that's not going to be enough. Yeah. Folks are going to have to do more than just mobilize and protest. We're going to really have to be innovative, and we're going to have to be strategic, because out of this type of tension, there is this opportunity to reimagine something new. In order to do that, we have to get on the same page. Case in point, we have been having conversations now for a little over a year, as Roderick alluded to earlier, around the University Hospital at Downstate. Now, all of this happened before this new federal administration, but yet in this now new federal administration, I think there could be an impact with the conversations that Roderick, myself, and others have been leading. I think overwhelmingly the community understands that they want this hospital to stay open. And we now have support from the governor that the hospital will stay open. And what has happened is that there's been a
commitment. How long before we're at it again, facing the same acts? How long?
We've been here before. Yeah, no, I hear that. I hear that loud and clear. And so I don't have the answer to that question, but I will say that I think the conversations now are trying to figure out how do you sustain excellence for the hospital and make sure that it is anchored and rooted within the larger complex of SUNY Downstate, right? The medical school really does well in training students, paraprofessionals, allied health professionals, but how do we ensure that they are also supporting the hospital in of itself? So what I was going to just mention really quickly is that, due to the mobilization and the advocacy of community boards and unions and clergy, is that, we have the funding, or we have some of the funding that is necessary to do some of that reimagining and renovation. we have an extension on the planning, and so there will be more public hearings that will happen where folks can come and ensure that their voices are heard. Again, these are the type of spaces that folks need to be in, because then you can get connected both at a local level and then see how this is rolling up at the state and the federal level. I think those are the opportunities to just continue to be connected. The more that they see us, and the more that they understand how important it is to our community.
I think you're muted. Thank you.
We have.
Hey, Doctor, you know what I want to ask is what I would like to see it. Some of these teaching hospitals, they have huge endowments, huge. You know, I don't know if that can be done. But you know, I look at you know, some of these hospitals in Manhattan, Presbyterian, Langone. I mean, huge monies that they have.
But it's also the location where they're located too. You know, you have in our area, in East New York, in Brownsville, in Bed-Stuy, they're not investing the same amount of money as you would in the Upper East Side.
But you know what, Doc? This is where Oh, but don't come here yet. This is where I have a problem with our elected officials. You know what? And if you look at the elected officials in these areas where these hospitals, safety net hospitals are, they're all people of color. And when you got the majority in the Senate, you got the majority, you got the Democrats controlling everything. Why are these safety net hospitals always begging?
You know, John, that's a good point. Unfortunately, I can't have him answer that question. We're running out. No. You know, John and I feel very strongly about the underrepresentation of the overrepresentation. I don't know if that makes sense, right? So in the areas that they're serving, they're underrepresented, but in office, they're overly represented. It's all like I don't want to reiterate what John said.
No. Yeah.
Right, it's very true, but it's always underrepresented in the areas that they're supposed to serve. The reason why I cut John is because we literally have about 1 minute left, and we do have to wrap it up. A couple of principals are asking me, do you do Career Day? And if so, how can they get in touch with you to do a Career Day? One, Nicola, who's on screen, one is May 22nd, one is May 14th.
Oh, you just popping out the look
I know the dates and they're
unreal. Okay.
I don't know. Wait, hold on. I don't know Madison's, but the principal is listening in, and a few other principals are listening in. So if you have a contact, an email, or something that you want to pop out on screen, so Andre can, our executive producer, can just type it on the screen so people can have it. Just pop it out.
And look, it doesn't have to only be Dr. Easterlin. He has a mentorship. So that's
the point, right? That's the point. If you know, the other thing real fast that I want to make sure that people understand, SUNY Downstate, and again, I wish we had more time, is #1 in the state for the state schools for producing Black and brown people in the medical professional setting. And it's not being stated enough. And I really wish we had.
So he might have to come back on again.
Yeah, you might have to come back on. That's what I'm thinking, because there's so much that we have to discuss, talk about as well. I think. Well, I hope it's not a. I would love to answer that call after we air, but just I give you 30 seconds to wrap up. I think we're actually we're right at time, Dr. Bryant. I don't know.
No. I want him to actually how can
see how we fight in Dr. Easterlin?
Yeah, and we're gonna continue to fight. How can people continue to support One Brooklyn Health? How can people reach out? Not reaching out for you to be Career Day, but just overall, the goal, the purpose, and making sure that they understand how to support the different hospitals out there. Like you mentioned, advocating, but what can we do to make sure that these hospitals stay around?
Yeah, it's a really, let me just say, I think there are three things that folks into. Your audience is very astute. I think on the network and the relationships that you have. I mean, there are a couple of things that are already, within the budget negotiations that could have a real impact. One, we're going to have to be able to cover the deficit. Whatever the federal administration, whatever happens there, the state will have to be able to cover the deficit. Again, we're going to have a direct impact on our safety net hospitals, specifically those in Brooklyn, if that deficit is not covered. We also have seen, loss of funding, $100 million to, our state and our city health departments. We, as a healthcare system, we're part of the public health system that has been able to help, stave off outbreaks and pandemics, i.e. the COVID-19 pandemic. It was both the hospitals and our public health professionals that made sure that we were able to keep people alive. And so, those are some things that we can continue to advocate to our elected officials that funding is needed in a downstate region. The second thing is we are a hospital. We provide health services. There's a lot of work that is happening. We have heart failure clinics. We have a kidney transplant access care center. There are a lot of new services within the system. And so I would invite folks to re-engage with the system, a lot of work that we're doing, because we do need those people to utilize those services. That's hugely important. And I think, the last thing is really just getting involved overall with health. And I think activating your network to figure out how we can come out, we can share the information, what we're doing, your church, your social organization, to see how we can partner to improve community health.
Thank you.
Thank you, Doc. Thank you very much for coming on the show today.
Yes, we appreciate that. And we definitely, you see, the listeners want you back. So Roderick is muted, and thank God he is.
No, I'm just saying, I'm just literally just saying thank you so much. And we look forward to the next opportunity to have a conversation with you. We could probably work it out with your schedule, see what's going on. There's so many questions, so many things that yet not answered. Benev, the beauty of the doctor is that they help to save lives. And each person has their own role in society. And the reason I'm only answering Benev's question.
We're not. Because thank you for being a role model.
No.
In the community.
I wasn't asking him to answer it. I'm just saying the reason why I'm answering it because we answer all of his questions when he comes. We call him the village pessimist, by the way, Dr. Easterlin. So thank you so much, and God bless you. Ladies and gentlemen, please make sure that you share, like, and thank you all of the villagers for participating in today's program. Thank you, Dr. Easterlin, for joining us and blessing us with the knowledge that we need to help to keep our community hospital open, fight for our own health care, and fight for our own level of independence so that we can get the services that we need within our area. God bless you, and hope to see you soon. Thank you.
Thank you.
Thank you.
Good night.
Good night.
Good night. Ladies and gentlemen, again, thank you again for joining us on The Village. Please like, share, and subscribe to our program. God bless each and every one of you. Good night.